How you doing, Miles?
Doing all right.
Good, good. I'm Charlie.
Hi, Charlie.
Charlie John, one of the physicians here. Wanted to ask you a few questions in regards to, and if it's okay with you, some questions in regards to your alcohol, drug use. And this is what this is going to do is just to give me a little bit better idea of how to handle and proceed with your medical care to make sure you get the best possible care. I'm going to ask about alcohol, cigarettes, tobacco, other drugs, prescription, non-prescription, possibly illegal that you've possibly been in. But it's going to help me get a better diagnosis of what's going on with you and to see if I can possibly get you to the proper level of care. In the past year, how often have you used the following? Alcohol, probably I would say in a sense of 5 or more drinks per day. Never, once or twice, monthly, weekly, or daily, or almost daily.
Almost daily.
Almost daily? Okay. About how many drinks a day would you say that was?
5 or more.
5 or more?
Yeah.
Okay. In terms of how do you consume that?
Just drink beer.
Beer?
Yeah.
Okay. And as far as your prescription drugs, do you take prescription drugs for any non-medical reasons?
Once or twice.
What was that?
Just whatever the doctor give me.
Okay. And then what about any illegal drugs?
Weekly.
Okay. And what drug is that?
A little reefer.
Okay. Cannabis. All right. So there. All right. What I'm going to do is just proceed a little bit here.
Yes.
All right. In your lifetime, which of the following substances you use? Since you did mention, I know you did mention cannabis, marijuana.
Yes.
So that was that. Were there any prescription stimulants, like such as your Ritalin?
No.
Concerto, any diet pills?
No.
Adderall? What about methamphetamines?
No.
Inhalants, nitrous oxide?
No.
Gas? Okay. Sedatives or sleeping pills? Valium, Seropax?
No.
Okay. What about hallucinogens? Acid, mushrooms, PCP? Special K, ecstasy? Okay.
No.
Street opioids? Heroin, opium?
No.
Okay, good. Now, prescription opioids would be fentanyl, Oxycontin, Percocet.
Don't like.
Don't like. You've tried them before?
Yes.
All right.
You taking me from what I'm trying to do.
Okay, so just a couple of quick, because you answered a couple of those questions, I might be a little bit concerned in regards to your usage. Before we proceed there, just give me a little bit of a history on your alcohol use.
I'm a drinker. I like to drink.
So you indicated that you drink 5 or more drinks
Yes.
per day. You said mainly beer. Okay. And cannabis once a week. I mean, what would be? You ever thought about minimizing?
I like to get high.
Okay.
And I don't want to minimize. Unless I have to.
Have you seen any? Has it caused any strains or problems in relationships?
We fight.
Right. Okay. Argue.
Yes.
Okay. Is it because you're drinking?
She complains.
Okay. Do you not see possibly what could possibly change?
I don't want to stop getting high.
Ask a couple of more questions if you don't mind.
Yeah.
Thank you. past 3 months, how often have you used marijuana?
Weekly.
Any particular reason? Or?
Like the way it make me feel. Take my stress away.
Okay, let's take your stress away. And in the past 3 months, how often have you had a strong desire to use marijuana?
Pretty often. I like to get high.
Okay.
That don't mean I always do it,
Okay.
but I think about it.
In the past 3 months, how often have your use of marijuana led to your health, social, legal, or financial problems?
Spend a lot of money. And like any bit saves, any bit helps. It's just weekly, but I could probably say cut back. Maybe only smoke it once a month. Maybe that'd be better for my financial.
Do you think those financial problems cause the fighting?
I mean, she complains about everything.
Do you think this is
Yeah.
a main? How do we think we would be able to possibly change that?
Make weed legal.
Okay, well, that's definitely probably been discussed more frequently than often, but that's another
It's
topic.
from the earth. So why is it a problem, She always wants to complain.
Yeah, but it's not legal everywhere yet. And there's
Well.
a lot of things, and maybe I could actually get you some research or as to some information as to why it may or may not be good for you, especially medically.
Your watch is blinding me.
In the past 3 months, how often has your use? Okay, there you see it daily. In the past 3 months, how often have you failed to do what was normally expected of you because of your marijuana use?
Sometimes. 50-50.
So would that be never, once or twice, monthly?
Once or twice.
Alright. This is for all substances never in use here. Has a friend or relative or anyone else ever expressed any concern about your use? Never, once or twice, monthly, weekly, or daily? A friend or a relative? No, yes, but not in the last 3 months, or yes in the last 3 months.
Yes.
In the last 3 months or not in the last 3 months?
Last 3 months.
Have you ever tried to fail to control, cut down, or stop using marijuana?
No.
Okay, just give me a quick second here. I'm going to take a second to just go over these. Alright, if you don't mind, I'm just going to take a second to just go over some of the, ask a couple of more questions for you here.
Okay.
It says here that you have 2 children,
Yeah.
and your relationship is on and off. We did discuss that the alcohol abuse may be causing a strain in the relationship.
Mm-hmm.
Have you considered any changes?
Sometimes.
Okay, you did come in with, I'm looking at your score, and you scored in a high risk for alcohol abuse disorder and as well as cannabis use disorder.
Ah,
I understand, and I'm just one of the questions I have to ask is possibly have you indicated that you visited the emergency room that you had some pain in your side.
yeah, I mean, yeah, a little bit.
Tell me about it.
I've been drinking one day and I started having a little bit of pain.
Okay, where about?
Right by the kidney.
Okay.
I think it's just from some football from back in the day.
Okay. And you referred to me because there was definitely some concern.
Yes.
Based on what was there. And I would think that I would be determining that if you were interested in possibly, making some changes.
Maybe.
Okay. Right here. So it's called a readiness ruler.
Yes.
Scale from 1 to 10. You're on a scale from 1 to 10, 10 being willing and ready. What would you rate yourself on wanting to change?
About like a 5.
5? Okay.
Sometimes I don't feel I have a problem. Sometimes I think it's them.
Okay. Well, you pick the 5. Why not a 7?
I don't know. Sometimes I like to get high. I don't know if I'm willing to get that up.
All right, but why not a 3?
Because I know I probably should make my wife happy.
Okay.
So I made it in the middle.
And that's definitely, congratulations, that's definitely a start that you're actually willing to change. I mean, based off of your readiness level, I may have some suggestions for you in terms of potential. There's outpatient treatment. There's some referrals to, the individual counselors that may be able to help you with assist you in your willingness to change. It's nothing that, maybe a scenario where maybe we just want to cut down what we're doing. Maybe just the willingness we cut down what we're doing.
Yeah.
Would you be interested in that?
Yes.
Okay. We'll just see here. You still employed?
Yeah.
What kind of work do you do?
Construction.
Construction? Okay. I thought it was a cook. Okay.
Yeah. I'm cooking right now. I want to do construction.
Okay.
But I'm cooking right now. Yeah.
Okay. Have you worked construction before?
But I be seeing the people in the street fixing stuff. I want to help them.
Okay.
Because my roads is bad, So I want to get out there and make them look good. But right now I be cooking up stuff for the, I like to cook a little bit too.
Okay. Where do you work?
Denny's.
Denny's? Okay. Out there in Lorraine?
Yeah.
Okay.
I make the best burgers you ever get.
Good. I appreciate it. I have to stop out one day.
Yeah, one day, man, come I'll give you the best burger you ever had.
You did mention that it's caused a little bit of problems. Have you ever missed work because of drinking?
Yeah.
Okay, why?
I just had a little too much. Couldn't make it.
Okay. Was there consequences behind that?
Well, I'm the best chef they got there. They gave me a warning, but, they know nobody make a burger like me.
How did that warning make you feel?
Like I need to be careful.
Okay. Again, it's assessing that your willingness to change, and I'm just doing this pre-screening here. Your willingness to change. I'd like to refer you to Mount Cherry. It's over in here in Lorraine County. Which Denny's do you work at?
The day on the east side.
Okay. East side of Lorraine?
Yeah.
Okay.
Best burger you ever had.
Okay. We're gonna definitely stop in one day.
Please.
So what I'll do is I'm gonna refer you to Mount Cherry and the physician's name is Dr. Todd Smith.
Okay.
And excuse me, not physicians, one of the counselors over there.
Uh-huh.
And we'll put him in. What day's good for you?
Monday.
Monday, 21st. And mornings or evenings good for you?
Morning. I do second shift, you know. Best burger you ever had. Make sure you pop in.
He has open Monday at 11 a.m. good?
That worked for me. Good.
What I'd like to have you do is definitely, I would try to reimburse if you could, let's consider maybe, cutting back a little bit
Yes.
until then, especially with the situation with the screening on your side to see if those tests come back as. And we'll have a follow-up with you. And we'll make that appointment at Monday at 11 at Dr. Mark Sherritt. And we'll go from there. Thank you for coming. Appreciate it.
Cool.